So, to start with, Chapter 9 covers risky health behaviors for adolescents and young adults. The teenage years are a time when young people feel invincible and ready to take on the world. They often throw caution to the wind, especially when it comes to things like health and safety. Now, research tells us that kids navigate their way through adolescence. As they go, they start to tune out their parents' advice more and more. But guess who they're listening to? They're listening to their friends' parents, and yes, their teachers. So it's a fascinating time because the world begins to open up in a whole new way. The cocoon of childhood starts to peel away, and in its place, these wings of freedom start to come out. But here's the catch. With great freedom comes great responsibility, and that's where things can get tricky. You see, we as humans are a lot like other animals. We're driven by our desires. We gravitate towards what feels good, what tastes amazing, what satisfies our cravings. But just like a kid in a candy store, having the freedom to choose doesn't always mean that we're making the best choices. So let's take self-control, for instance. It's a lifelong struggle for some. Temptations are everywhere, and managing them can be quite challenging. So in fact, the National Institute on Drug Abuse shared a startling statistic in their report called Monitoring the Future. It was back in 2009, but it revealed that the consumption of substances like alcohol, tobacco, marijuana, and other illicit substances would double from 8th grade to the 12th grade. So the lesson here is not to demonize the freedom or people's desires, but we have to emphasize the importance of responsibility and making informed choices. And these are all things that health communication can play a role in. There are a number of serious health consequences that are associated with substance abuse and addiction, including lung, cardiovascular disease, cancer, stroke, brain function problems, and even mental health disorders. And impaired judgment and lowering of the inhibitions can be linked with also risky sexual behavior, and all that's attributed to things like unwanted pregnancies and sexually transmitted diseases. When it comes to sexual behavior, it's scary to think that you might catch genital warts or herpes just from the act of rubbing or kissing. But the problem is that there's no cure. So when it comes to health education, we can promote things that prevent STDs. And for many years, the health campaigns focused on abstinence. But that didn't change the importance that comes with understanding the landscape. That's why health education is so crucial. It's not just about scaring folks with what ifs about this or that, but it's about promoting preventative measures against sexually transmitted diseases. And for a long time, the mantra was just say no. Abstinence was the name of the game. But let's get real. The whole picture is just as important. So, for example, I've talked with many people who don't understand some of the basic things that are important to know about getting pregnant. And like, for example, sperm is still active in pre-ejaculate that men put out. So what that means in layman's terms is just that the pull-out method during sex does not work. So unwanted pregnancies are helped by condom use or birth control. But nothing is guaranteed. And these are all dynamics that younger teens or young adults may not understand, even if they had sexual education classes in school. Many of you may know that there are some STDs that have a vaccine. One example is hepatitis B, and another example is genital warts. And these vaccines make a real difference when it comes to health outcomes. And they're just not random shots that you get from a doctor's office. They're powerful tools in our fight against these diseases. And they really do make a difference in people's health and lives. So that's why they're key players in this health communication outreach programs. Now, one of the game changers out there that's going on that some of you may not know about in HIV prevention is pretty spectacular. I don't know if anyone has heard of PrEP. It's pre-exposure prophylaxis. And it's not a study technique or a fancy name. It's actually a daily pill or a shot that I think it's a monthly or bi-monthly shot that you can get, that when you take the pill or you take the shot, it prevents you from getting HIV. So that's a big deal. And the best part is that a lot of insurance companies cover PrEP 100%, the whole thing. And the reason why is because they see it as a preventative, like a seatbelt for your sexual health. So for those of you who are sexually active with multiple partners, this is a real fantastic option for a lot of folks. So it's effective and covered by your insurance, and just another tool in your arsenal to protect your health. So there are a number of different pills that are prescribed like this. And my understanding is that it delivers a low-level HIV treatment drug all the time, so that it's always out there looking to fight this from ever coming in your body. So I wanted to talk next about some of the theories in health communication that can complement this, because we don't just study these problems with risky sex behavior and drug behavior among adolescents without a plan. And so one of the things that contribute to the plan are some of the theories in health communication. And so I want to first consider the intrapersonal communication models that are out there. And when we say intrapersonal, we're talking about the what's happening in our own mind. So as opposed to communication between two people, this is communication with ourselves. And intrapersonal communication models are models all about understanding the internal thought process and the beliefs that led someone to believe or engage in certain behaviors. So the book covers a number of these, and if we take the health belief model, for instance, this model suggests that a person's belief in a personal threat of an illness or disease, together with a person's belief in the effectiveness of the recommended health behavior, will predict the likelihood that the person is going to adopt the behavior. So it's like if someone believes that they're at high risk for developing lung cancer, and then they believe that quitting smoking can reduce the risk, then both of those things add up together to show that the person is much more likely to quit. So that's the health belief model. Then we have the theory of reasoned action, or TRA, and the theory of planned behavior, the TPB. The theory of reasoned action proposes that a person's behavior is determined by their intention to perform the behavior, and that is a function of their attitude towards the behavior. All right, so that's the theory of reasoned action. And then the theory of planned behavior kind of extends that by adding that, this perceived behavioral control item. So in other words, it kind of looks at whether a person feels like they actually have control over performing the behavior. So there are different theories for thinking about how this intention part works out for the person. And so let's say a teenager wants to try drugs. According to the theory of reasoned action, this TRA, their decision would be influenced by their personal attitudes towards drug use and by the social pressure they feel. So those are kind of the things that would contribute. If we were looking at the theory of planned behavior, it would add sort of this element to figure in whether the teenager feels that they have the power to resist the peer pressure. So it's just a model to kind of conceptualize these things. And anytime we put together a model, that's what it helps us do, because we might need to take different situations and apply it for understanding. So the integrated behavioral model also provides some relevance to this. And the IBM model, the integrated behavioral model, is essentially an expansion of the theory of planned behavior. And it identifies different constructs that directly influence behavior. So it really helps us be able to think about the things that might make action. And so those things are things like attitude, perceived norms, personal agency, as like how much control you think you have, intentions, your environmental constraints, knowledge, and skills. So this integrated behavioral model is helpful to see what components that might contribute to what's going on for a person. So for instance, someone might know that eating fast food regularly isn't healthy. That's the knowledge that they have, but they continue to do it because they enjoy the taste. That's the attitude that they have. Their friends also eat fast food often, so that's sort of a perceived norm. And as a result, they feel like they can stop anytime. That's self-efficacy. The thing is that they also live in an area where fast food outlets are more accessible than healthy food options. So there's also environmental constraints. So you can see that how fast food has multiple parts that can contribute to the person's use. Now, the next model to mention is the trans-theoretical model and stages of change. And this model suggests that people who move through different stages when modifying behavior, and that those different changes and stages can be identified. And so it's like thinking about something beforehand, so pre-contemplation, and then there's a contemplation stage, a preparation stage, an action stage, and a maintenance stage. And so when we think about behaviors, it makes me want to go down like an attorney would about like, did you mean to commit this crime? And so at some point, those thought processes that connect with the actions are all identifiable. So let's use the example of someone trying to quit smoking. In the pre-contemplation stage, they're not even considering quitting. And then in the contemplation stage, they start thinking about quitting but haven't made any steps yet. Preparation is when they start making small changes, like cutting back on the number of cigarettes per day. Then action would be when they actively begin to quit, moving to stop. And then maintenance would be when they actually work to prevent a relapse. So you can see that these different stages are, or this process of stopping smoking is easier to understand when we have a way to break it down. And so again, this is another reason why these models can be helpful, because when we understand how things are being explained, it just helps us be able to apply other situations and understand better. The other model that I want to bring up is called the precaution adoption process model. And the precaution adoption process model is another stage theory, which suggests that people go through several stages when deciding to take action to prevent a health problem. So these stages include the fact that they're unaware of the issue, and then they're unengaged by the issue, and then they have a decision to make about acting, decide not to act, decide to act, finally acting, and then the maintenance mode. So this precaution adoption process model helps set up a framework for understanding where someone's at in the process. So for example, if we think about someone deciding to get vaccinated for the flu, initially they may not even be aware that a flu vaccine exists. So that'd be like in an unaware stage. Then they might learn about the flu vaccine, but not really consider it relevant to them. So they'd be in an unengaged stage. Then they might start to weigh up on the pros and cons of getting vaccinated, so that it would help them be sort of in a deciding stage. And all this happens before making their decision and taking action. So these models help us understand that changing behavior isn't just about making a single decision. It's a process often with several stages influenced by a range of internal and external factors. So by understanding this, we can tailor health communication interventions in a way to match individuals' readiness for change and support them more effectively through their journey towards the the healthier behaviors that are set up for our goals. So now that we've talked about this intrapersonal communication that we've done with ourselves in model forms, next I want to talk about interpersonal communication models. So before we went and looked at how we think in our own mind, and now we're going to talk more about the interactions that happen in some of the models that help explain that. So in interpersonal communication, like communication between two people, we have a couple of different theories to mention. And one is the social cognitive theory, or the social learning theory. And so I want to consider how the parts of these can come together and influence behavior, explain the influence of behavior. So, for example, when it comes to the social cognitive theory, it might look at how a young adult's decision to drink alcohol could be influenced by looking at their friends' drinking behaviors. So also things to consider would be their beliefs about outcomes of drinking, like what happens to them, and the social and environmental factors that make the drinking more appealing. So to sum it up, when studying risky behavior, it's important to consider both the intrapersonal communication models that could play, and also the interpersonal factors that have to do with other people in the environment. And all these, again, help us when we work towards a more comprehensive understanding of how we think through these actions that people take. And as a result, the goal is to help promote healthier choices and make plans to communication plans or action plans to facilitate that. So that helps us look at chapter 9. And now that we've looked at chapter 9 and been able to talk about risky behaviors and some of the models that we use to study those, both within our minds and with interacting with others, now we'll move on to chapter 10, where we'll be able to look at mental health illness. And mental health is a topic of vital importance, but it's often overlooked or misunderstood. And the statistics about mental health in America, I have pulled from a lot of different sources that I listed on the reference for our lecture. But one of the biggest statistics that came out was that about 20% of the population in the United States is battling from some form of mental health issue. You know, what's even more concerning is that nearly 60% of these individuals don't receive any treatment or medication. And I know it was a long time ago, but in 2019, they had a study that showed that an estimated 47 million adults were grappling with mental illness, but only 43% of the people received any kind of mental health care. And so this lack of treatment can have dire consequences. More than 40,000 Americans die annually from suicide, making it the 10th leading cause of death in the U.S. The prevalence of mental health issues is particularly high among adolescents and young adults, with rates reaching 50% and 30% respectively. So anxiety disorders are the most reported mental health issue in the U.S., affecting 42 million Americans. And women experience depression at roughly twice the rate of men, further highlighting the gender disparities to consider in mental health. The economic impact of mental health is also significant. Serious mental illness costs the country more than $190 billion in lost earnings every year. And an estimated 26% of Americans who are ages 18 and older suffer from a diagnosable mental disorder. And almost half will experience an episode of mental illness in their life. So in the realm of children's mental health, there are 4.5 million children in the U.S. who are diagnosed and living with anxiety. ADHD, behavior problems, this anxiety and depression are just really common mental disorders that affect kids. And so on a global scale, these numbers are equally concerning. Approximately 322 million people worldwide live with depression, and almost 800 million people suffer from mental health disorders worldwide. So the mental health landscape in colleges is also noteworthy because over 25% of college students have been diagnosed or treated by a professional for a mental illness. Unfortunately, about 64% of students stop pursuing their college education due to mental illness, and more than 70% of students with mental health conditions have experienced a mental health crisis while on campus. So many college students are seeking help for their mental health concerns, but about 34% of students with mental health conditions said that their college didn't really know about their crisis. And this is concerning because that's considering that 95% of college counselors report that mental health concern is growing on campus in general. So the primary causes of mental health in college students range from stress over grades, financial anxiety, overwork, sedentary lifestyles, biological, genetic causes, even traumatic events, including sexual assault and racism. And mental health is a pressing issue that needs immediate action and attention. The statistics shed light on the extent of the problem and underscore the urgent need that we have for increased awareness, early intervention, and the access to treatment and support services. So, I want to talk next about some of the most common mental illnesses so that we can sort of be aware of what we're talking about in the landscape of what's out there. And so one of them is anxiety disorders. And this is the most common type of mental illness. People with anxiety disorders respond to certain things or situations with fear and dread, as well as with physical signs like anxiety or panic. And things like that can come out through rapid heartbeat or sweating. So that's anxiety. And so now that we talked about anxiety, let's talk about depression. Major depression is a mood disorder that's characterized by this persistent feeling of sadness, hopelessness, and loss of interest in activities. It affects how you feel and behave, and it can lead to a variety of emotional and physical problems. So that's depression. And so now that we've looked at depression, let's look at bipolar disorder. Bipolar disorder is also known as manic depressive illness, and its condition can cause unusual shifts in mood, energy, activity level, or the ability to carry out day-to-day tasks. So mood range from extremely up or into like these manic episodes or very sad, hopeless periods that are depressive episodes. And that's what characterizes, or it can help characterize, bipolar disorder. So now that we've looked at that, let's look at schizophrenia. Schizophrenia is a mental disorder that affects how a person thinks. And it's how they feel, how they behave. Some people with schizophrenia may seem like they've lost touch with reality, which can be distressing for them and for those around them. I think, one of the most common things about schizophrenia is hearing voices or seeing things that aren't there. And we know that it commonly, onset happens in teenage or young adult years for those who suffer. And so the next issue to bring up is called post-traumatic stress disorder. Many people talk in general about PTSD, but it's a disorder that develops in some people who've experienced really scary, dangerous, or shocking events. And a lot of times they're revolving around death or horrible situations. And these symptoms can include flashbacks, nightmares, severe anxiety, or even uncontrollable thoughts about the event. And so That's PTSD. And now let's look at obsessive compulsive disorder. OCD, obsessive compulsive disorder may have symptoms of obsessions and compulsions or both, but the symptoms can interfere with all aspects of life, such as work, school, and personal relationships. I think that we see a lot of examples in media of this. Similar to PTSD, OCD is commonly described and talked about. Another mental health concern is eating disorders like anorexia or bulimia. And these disorders involve extreme emotions and attitudes and behaviors around weight and food. And they're serious and can have life-threatening consequences because some folks are compelled to exercise to the extreme levels, and other folks are compelled to eat a lot and then vomit that up. And so all of those things can cause major problems. And it's more common than we might think that the long-term effects that these things can cause. Another mental health concern is the attention deficit disorder, or attention deficit with hyperactivity disorder. It's one of the most common neurodeveloped disorders that's found in childhood commonly, and it's when it's first diagnosed in childhood usually, and may continue into adulthood. But folks have a difficult time paying attention and controlling impulsive behaviors, or being overly active and difficulty focusing. The disorders that I'm mentioning, I'm just able to give some descriptions to help us with a basic idea of each disorder. So it's just important to remember that these disorders are multifaceted and complex. And in this opportunity, we only have a brief amount of time to just do an overview. But drawing from my personal experiences as a paramedic, I found myself in numerous situations where I've had to interact with individuals who are grappling with mental health illness. And a significant portion of people we encounter on the streets as paramedics are there because they're wrestling with challenges of conforming to societal norms. And this can be, made worse by these mental health issues or substance abuse issues. And those are really the two things that I see that make this a problem. So we have a patient who has schizophrenia and hears voices, refuses to take their medicine, so they can't stay at home with their family because of their actions. Or the drug-dependent folks are not able to interact with society or be able to even be cared for by their relatives because it's so extreme. So these are two common reasons that we see folks that are homeless. And a pivotal moment in history of mental health was during the JFK presidential administration, which brought about sweeping changes in the landscape of psychiatric treatment. And reforms then led to the closure of many long-term psychiatric hospitals across the country. So those were the places where people would stay for their lives sometimes. And so instead of people being in the hospital, they were moved to other places, reintroduced to society. And the fallout of that policy shift meant that patients who were once inside the institution were now fully integrated with society more. And so this caused an increasing number of individuals to be homeless and then cycle in and out of short-term psychiatric facilities. And so a lot of times some of the psych facilities, the majority that I'm aware of, are going to take care of you between 3 and 7 days. And so we're not looking at the kind of living there and getting long-term treatment for a lifetime system like we had before. And so now we have disparities because these people are not able to manage themselves, but now are not in an institution that helps them with that. And so this is just another contributor to what we talk about with the homelessness problem. And a really large number of these individuals end up in emergency departments. And emergency departments are overwhelmed with psych patients trying to get placement in a facility, because it can take time to find a facility. And my experience is that if you walk into an average emergency room, you may have as much as 1/3 of the patient population as psychiatric patients. So that means that you have nurses that are assigned to those, but then also they have to be watched so that they don't kill themselves or hurt someone else. And so there is a sitter that has to watch those folks. So usually it's a one-on-one sitter for each psych patient. And it's just really demanding on these institutions. So I'm really happy that we've been able to talk through in lecture time today 2 chapters, and we're digging in through week 6 through our class period. I encourage anyone to reach out to me if you need anything or want to do time with office hours. And I appreciate your active work in the discussion that we have together. So until next time, thank you.